Welcome to Family Friends Veterinary Hospital in Grand Rapids, Michigan, where today we're going to walk you through a TPLO surgery, or tibial plateau leveling osteotomy. Our patient today is Peppa, a playful and loving pit lab mix and beloved employee pet who's been dealing with a painful limp caused by a torn cranial cruciate ligament. When Peppa arrived that morning, our team checked her in and reviewed details with her owner, making sure everything was in place for a smooth surgery. Next, we place an IV catheter to administer fluids and medications throughout the procedure. This area must first be cleaned and shaved, and a guard is placed to keep pets from being able to reach the IV. Then, x-rays have to be taken to assess her knee and confirm our surgical plan. This step is very important for doctors to be able to see and measure the bones prior to setting the metal plate during surgery. Once x-rays are done, Peppa received a light sedative to relax before heading back to her kennel to rest and wait for her surgery in a couple of hours. Before bringing her into the surgical suite, our team preps the room with all necessary tools and equipment and go over the plan and images for the day. And now it's time to bring Peppa in and get started. While she is seated on the floor, our licensed veterinary technician administers the anesthesia and waits for that to set in before getting assistance to lift her onto the surgery table. They then work quickly to get her intubated and connected to the monitoring equipment, which tracks her heart rate, oxygen levels, and blood pressure throughout the procedure. We have to then shave and disinfect the entire surgical site to maintain a sterile surgical field and reduce the risk of infection. Hair can trap bacteria and debris, so removing it allows for thorough skin disinfection, and the added visibility helps surgeons make precise incisions and reduces post-surgical complications. The last step before making the first incision is to carefully wrap her leg to keep the area sterile. As you can see, our team has gotten this down to a science, with each member playing an important role. Before surgery begins, while the pet is under anesthesia, Dr. Ryan took a moment to manually manipulate the knee and confirm the tear and assess the degree of stability. The TPLO surgery begins with an incision over the knee to access the joint. The damaged cranial cruciate ligament is removed, and if needed, the meniscus is trimmed or repaired. A precise curved cut is then made into the tibia, allowing the tibial plateau to be rotated into a more stable position. Once the bone is properly repositioned, we secure it with a strong metal plate and screws. This plate holds everything in place as the bone heals and gradually fuses in its new alignment. The repositioning of the tibia eliminates the need for the damaged ligament by preventing excessive movement in the joint. After ensuring the stability of the repair, we flush the area with sterile fluid to reduce inflammation and minimize the risk of infection. The incision is then carefully closed in multiple layers, and a protective bandage is placed over the leg to keep it clean and secure during recovery. The first 2 weeks after surgery are crucial for healing. Limited movement, strict rest, and short, controlled leashed walks help prevent complications. Bruising can also be alarming to pet owners, but expected, which is why we recommend using ice packs on and off for the first few days. At her follow-up, we check Peppa's incision and make sure everything is healing as expected. As part of every TPLO recheck, we also provide laser therapy to reduce inflammation, ease discomfort, and promote faster healing. Over the next several weeks, her activity will slowly increase, with physical therapy playing a key role in her recovery. By 12 weeks, she should be back to enjoying life on 4 strong legs.